Another side effect with these medications is hypertension. It's common with sunitinib, with Nexavar, and bevacizumab. That's why taking a baseline blood pressure is very important, and it's also important to monitor the blood pressure during the initial weeks of therapy. Sometimes antihypertensive medication has to be initiated, or if you're already taking medications for high blood pressure, sometimes we need to adjust them a little bit. Hypertension requires close monitoring. You may not need to interrupt your dose or dose reduce. Rarely do we see it with temsirolimus or Afinitor, but still it's very important that your blood pressure is carefully monitored, especially in the early stages of treatment with sunitinib, Nexavar, and bevacizumab. Some laboratory abnormalities that we see with these medications. When patients are on bevacizumab, which is the IV infusion every 2 weeks, we always order a urinalysis test prior to the infusion because sometimes protein is spilled into the urine from the kidney. It's important that routine blood tests are done. For some of these medications every week, sometimes it's every 2 weeks, and when you've been on them for a while, they can almost be every month because these medications can cause a drop in your hemoglobin, leading to anemia, a decrease in platelets leading to thrombocytopenia, which could make someone susceptible to bleeding and easy bruising, and also a decrease in your white count, which makes you prone to infection. We're always looking for elevated serum creatinine because the last thing that we want to do is to hurt somebody's remaining kidney, and it's important that we test cholesterol levels and triglycerides because temsirolimus and Afinitor cause those two blood levels to bump up, and many times you will be asked to have a fasting blood test for cholesterol and triglycerides. You're going to be asked very frequently about what medications you're taking. Right off the bat, your doctor's going to want to know, do you have high blood pressure and what medications are you on? Are you on blood thinners? What vitamins? Are you taking any herbal products or enzymes? Many of these medications can actually interfere with these targeted therapies. If you're on these medications, they can either make the targeted therapy ineffective or they can make it toxic. And it is really kind of a give and take depending on what other concomitant medications you might be on and how they affect the blood levels of these drugs. It's recommended that grapefruit juice or starfruit not be taken on these targeted therapies. Do not take St. John's wort, which is an over-the-counter medication, and always consult with your doctor before taking any new medication. Sutent may be taken with or without food, so it's independent of whether or not you're taking it with a meal. Nexavar is a little bit tricky because you need to take it at least 1 hour before or 2 hours after. Toracel is IV infusion once a week. The bevacizumab, as I mentioned, is once a week. And the Afinitor is daily dosing, and it should be taken with a tall glass of water, independent of food, but with a lot of liquids. So with that, I'm now going to turn the presentation really over to you, and I look forward to your questions and hope I can give you some good answers this evening.
Okay, just real quick before I start going into the questions, a few people did ask if you could, how you could get a copy of the presentation or see it again. It is being recorded, and we'll have it up on the Kidney Cancer Association website probably early next week, so you'll be able to go back and view it again. And one other thing, because there were a lot of very specific questions regarding side effects with medication and some other maybe remedies that people have tried that might not have been mentioned. Our online chat room, it's kcalist.com, we have thousands of patients and survivors that are on there regularly. So if you haven't visited there before, perhaps you want to go on there and ask your question or say your specific side effect, because sometimes patients try things and that they might get from another patient that might be helpful too. So, all right, let's see here. The first question that we have, could you maybe describe a little bit some of the, I guess without getting too scientific or too in detail, the difference between some of the different therapies, Sutent and Nexavar, maybe versus Toracel, kind of how they differ?
Okay. The question is talking about the mechanism of action of, let's say, Sutent and Nexavar versus Toracel and Afinitor.
Mm-hmm.
And I'll just kind of group those two for right now. Sunitinib and Nexavar are what we call multi-kinase inhibitors. They actually they attach themselves to receptors in the what we call the endothelium, or the blood vessels, the structural components of the blood vessels. And they hook them onto receptors, which actually prevents blood vessels from forming. And they are inside the cell, and they inhibit certain pathways that lead to cell growth and cell proliferation, all the things that cancer cells do. So they have their own pathways that they work on. In contrast to temsirolimus or Afinitor, they're also targeted therapies, but they work on what's called the mTOR pathway. So it's a different pathway. And sometimes in some kidney cancers, they can be more responsive to one pathway versus another. So mTOR is affected by the two drugs, Afinitor and temsirolimus. Both of them both are anti-angiogenesis because they stop the formation of new blood cells and they stop the cancer cells from proliferating. So they halt cellular growth, but there's different pathways inside the cell. And then I'll just bring in the fifth drug, which is bevacizumab, and that drug is called a monoclonal antibody. And that drug works totally different from the other four that I mentioned, because that drug actually hooks onto the receptor that's kind of floating, in circulation, preventing it from attaching to the